Hutchson of Texas. And Senator, look, two things that Republicans had real problems with have now been removed from this. Do you think that that makes it a little more palatable for passage?
Well, I certainly think we need to see the details of this new nonprofit option. And in the original language, we haven't seen the new one, it said that if no one bid on producing this, that then the government would be able to provide one. So we need to see more of the detail. But Liz, no matter what, you're still going to have $500 billion of cuts to Medicare and $500 billion of tax increases on employers and individuals and companies that produce our prescription drugs and the insurance companies, and that's going to raise prices. So I think that we need to look at this whole thing, and in this economy, I don't see these huge tax increases and cuts in Medicare being the right approach.
Senator, the folks that are listening right now are particularly interested, particularly the small businesses, in what kind of taxes they might face, other than taxes specifically targeted to companies that make medical products or pharmaceuticals. What will the small businesses face there in terms of new taxes?
Well, they're still going to face a fine if they don't provide coverage for their employees that meet certain criteria. And that means that every small business is going to have higher costs per employee, which in itself, as you know, is something that makes a business not want to hire more people or even to have to face layoffs. So the cost to small business, I think, is significant. And they have a temporary tax credit, but it's very temporary, and it only applies to a very, very small level of employee base.
But Senator, here's what they've seen year after year after year: double-digit premium increases per employee from the private health insurers. They have seen their costs for health care go up and up. If the government now throws in what they are calling this opportunity, more like a co-op opportunity for people to put together pools of ideas for insurance, don't you begin to think that maybe these private insurers will bring their prices down, their premiums down, to more fair market-based approaches so that things become a little more easy to swallow for the small businesses?
Well, I think that certainly the goal should be to have affordable health care options for small businesses to offer their employees and for individuals to purchase. I think that should be the goal. I think the question is, with all of the taxes and fines and the higher costs that are going to be in the bill, that you would be able to provide lower cost alternatives. And I think that is the question. And of course, we haven't seen the bill yet.
Senator, do you still think that this bill is an attempt by those who favor single payer to get there?
Yes, I do. I think that eventually, if you have the private sector unable to compete with a subsidized public sector, you're going to end up with the private sector going out of business and employers just opting to let people go onto the government subsidized co-op or option, and it's going to end up where I believe they want it.
This is great for the insurance companies. Everybody's going to be forced to get insurance.
Well, but there is the publicly offered nonprofit that is going to compete with the private insurance. And if the private insurance companies can't compete, then I don't see that that is going to provide the competition and the low cost. Like, someone has to absorb these taxes, and it's going to be the consumer. Everything is going to go up. Prescription drugs are going up, medical equipment is going up, the cost to the private insurance companies. You've got $100 billion of new taxes that take effect next month. Next month.
Senator,
the bill doesn't come into effect for 4 years, but the taxes start next month.
We've got to run, but thank you very much.
Taxes up, regulations up. Doesn't sound like much of an improvement. Kay Bailey Hutchison, good to see you. Thank you very much.
Thank you.